the next speaker.
Yeah, now I call upon Dr. APURVA for her presentation on innovative bladeless pterygium surgery, a non-traumatic approach. The discussants would be Dr. Nandakishore and Dr. Arun Kshetrapal.
You can't sleep.
Sleepy. Party there.
Can I start?
Yes, yes, yes.
Good afternoon, everyone. My name is Apurva, and today I'll be talking upon bladeless innovative pterygium surgeries, a non-traumatic approach. As we all know, that pterygium is a progressive, non-inflammatory, and wing-shaped degeneration of the conjunctiva over the cornea. Because it is an agricultural country in India, UV rays have raised the risk of pterygium to a higher level. But pterygium excision surgery can be performed by any ophthalmologist, may it be a retina surgeon, a glaucoma surgeon, cornea surgeon, or a cataract surgeon. So, the need to know about the pterygium excision surgery is very important for all the surgeons. The pterygial excision techniques available are bare sclera technique, amniotic membrane grafting, CAG with sutures, and CAG with fibrin glue. But for pterygial head removal, we mostly use blades, that is beaver knife, 26 gauge needle, scalpel blade, diamond knife, and crescent blade. If you are a senior surgeon, then you will know how to get the correct plane of dissection and how to dissect the tissue from the corneal tissue. But if for the novice surgeon, it may lead to complications like reduced wetting, retained tissue, injury to the Bowman's membrane, irregular plane of dissection, or poor cosmesis. To avoid these complications is new surgeons, which are learning pterygium surgery. We have come up with two innovative atraumatic techniques, that is the Terry snip and Terry peel.
Terry snip, a suture-based pterygium removal. Step 1. A superficial epithelial incision is made with a 26-gauge needle parallel to the head of the pterygium. Step 2. A small nick is made in the lateral borders of the neck of the pterygium. Step 3. A cyclodialysis spatula is passed beneath the pterygial tissue from one end of the neck to the other to create a clear dissection plane. Step 4. A 4-0 silk suture is now passed in the same dissected plane. Step 5. Tight hold of the suture ends is obtained by using a clamp and tying forceps. Step 6. A slight countertraction is applied toward the base of the pterygium, with the spatula that's held in position under the neck tissue by assisting step. Step 7. Swiping movements are then made along the dissection plane toward the apex of the pterygium. This action will remove the entire pterygial head with no residual tissues underneath.
So the disadvantages of this technique are 2 people are required for the countertraction, and the abnormal plane of dissection can lead to retained tissue post-surgery.
Bladeless technique
In the
is
second technique,
a peel-off technique for pterygium head removal. Step 1. A superficial epithelial incision is made with a 26-gauge needle parallel to the head of the pterygium. Step 2. Identical to a conventional pterygial head removal, the neck of the pterygium is cut with scissors at the limbal border. Step 3. A good grip of the complete pterygial head is obtained with a clamp. This clamp helps to achieve hemostasis in the bleeding pterygial tissue and also aids in easy removal. Step 4. The clamp is then used to peel off the pterygial head in a centripetal pattern so that the entire head is removed in 2 or 3 movements. The residual tissue after this technique is so minimal that it completely alleviates usage of the blade, and a simple polish of the burr is adequate.
so the disadvantages of this technique are customized instrument for grasping is not available, and lack of counter traction can lead to globe traction, and harder grades of pterygium are difficult to manage.
These are our 2 simple and effective techniques for a bladeless pterygium excision that anyone can easily adopt.
Yeah, I noticed that you still used a blade in the
Sorry?
second procedure.
Yes, sir.
And then instead of a blade, you used a 26-gauge needle. What's the specific advantage? I mean, it's some form of cutting, whether you use a blade or a needle. Does the needle help you in any particular way to control your depth of cutting,
Sir,
or it's the same with the blade?
So in needle, we are only doing a incision over the superficial epithelium. We are not going any deeper. So just for the plane, so that it doesn't go any further, that we are removing the tissue. We are just cutting it to give a border of the cut to come out. We are not going to cause the. We are not trying to dissect the plane with the needles. The plane we are trying to get from the base of the pterygium so that we can extend that same plane, because new surgeons, we are finding it difficult to find the plane. They keep on scratching with the blade, and then it leads to multiple planes, and retained tissue is left at the end of the surgery.
Even in the peel technique, I noticed that there was some residual tissue left.
Yes, sir. Little
So-
bit, if even if little bit residual tissue is there, so it can be loosened, and it can be washed off with the little minimal burr usage, sir.
Excellent technique. The idea, I think, behind giving a cut is that you don't peel more of an epithelium. So epithelium peeling is limited to that
Yes, sir.
area. Excellent idea. I think this technique will work with atrophic pterygiums and will not work in the young people who have very strong adhesions. I'm slightly skeptical whether this will work in
Yes, sir.
young.
So mostly it is for the getting the correct plane of dissection, and then it is not for the severe grades of pterygium. Mostly for mild to moderate grades of pterygium, which
Yeah,
is
and maybe atrophic pterygium in the older
Yes, sir.
people, it will work fantastically well, I'm
typical,
sure.
yes, sir.